Hello, my name is Emily Carroll. I'm a family nurse practitioner and the director of clinical care here at HealthFinders Collaborative. We're a community-based clinic here in Bryce County, Minnesota. And I grew up actually in Canada, where we have state health insurance, and I'm on the clinical side of things here. So I don't come to insurance through education or experience, but I really come through insurance as a consumer, as a Canadian trying to figure out how to make this plan work for me and my family. And then with my clinical knowledge, I'm starting to learn how you can make the most of your plan. I'm also to be honest, pretty tight-fisted, pretty cheap. So I like to squeeze every last cent out of anything I buy, especially something as expensive as my family's health insurance. My first recommendation for anybody, especially somebody new to the town or the state or to health insurance at all, is to establish a care with a primary care provider that you like and you feel good with. This could be a physician, a nurse practitioner, a physician assistant. I would just guide you to somebody that you feel that you have a warm relationship with, and also think of the sort of conditions they treat. If you have an internal medicine physician or a nurse practitioner, they will not be able to treat your children. If you have a family nurse practitioner or a family practice doc, they could treat the whole family. If you are older and you don't have children and you have more health problems, that internal medicine specialist who specializes in adults is perfect for you. But if you're looking for a family, somebody who could know your entire family might be a better choice. All health plans pay for one wellness visit a year, and that's really a chance to meet that primary care practitioner, physician, nurse, physician assistant, and make that relationship and update them on your health and things that have changed in your family. Having that relationship is important clinically for your health, but it also really works for health insurance. Because if something changes or you're in a pinch, once you have that relationship, you could call that practitioner and ask for perhaps a refill, or if you have a minor health complaint or just a question. They know you, they know your health history, and they are much more likely to offer advice, guidance, or a referral without coming in for a visit. And that works well, I think, for both people. I'd also encourage you to take full advantage of that one wellness visit that insurance plans pay for. So we're used to taking our kids, to get weighed and measured and look at their growth charts every year when they're growing up. But really, I would encourage you to continue with that throughout adulthood, even if you're feeling well. In fact, especially if you're feeling well, because those are the times you're more open and more willing to talk about your blood pressure, how you can reduce your risk of cancer, heart disease, other things that might be in your family history that you want to have a chance to talk about. There is a long list of services that the federal government they demand, it's the law that health insurance plans must cover. And most of us, we think of mammograms or breast cancer screening or cervical cancer screening, vaccines. But there's actually a pretty large list of these covered services that insurance plans have to offer without any copay or coinsurance. If you're thinking about a vaccine, cost should not be an issue. It is the law that health plans have to cover that with no coinsurance. Same thing goes for blood pressure screening, high cholesterol screening, talking about your family history, and all of the preconception, so services that a woman might choose before she wants to become pregnant to make her as healthy as possible before pregnancy. And the same goes for the other end of family planning or contraceptive. Those contraceptive services should also be covered with no copayment. Every insurance can be a little bit different. Of course, I would never want anybody to take what I say and get hit with a bill. So there is always the number on the back of your card to make sure that a certain service is covered. But start thinking about how you can make the most of that visit and look at your benefit letter that comes with your insurance plan, or just call if anything doesn't make sense. And then when you're not well and when you're ill, one option that depends on your insurance or where you are would be a convenient care or an urgent care clinic. There are online services that I would not think twice about using for my family. There's VirtueWell, run through the HealthFinders system, and some other online urgent care websites where you fill out a questionnaire with your health complaint, and typically these are fairly minor things like acne or a rash, urinary tract infection. But you go through the medical interview online, and perhaps even upload a picture if it's a rash, and then you either speak to somebody or communicate with them another way or video conference. And if they can treat you, if it's appropriate for them to treat you, the cost, ones that I checked just before here, the Virtuelle is no more than $45. And some insurance plans will cover that as well. Now, if you have something that's more complicated than what they can reasonably handle, or if it's more complicated, you will not be charged $45 to find out that it was too complicated or it wasn't safe for them to treat you. They will not charge you for, I don't want to think of it as a wasted visit, but an inappropriate visit. So that, I mean, if you have a high deductible plan, being able to get a urinary tract or yeast infection or sore throat or rash evaluated for $45 is a really good deal. Now, of course, as a primary care practitioner and as myself, you know, ideally I'd want my patients to come to me because I know them and I could treat their rash too, but I understand this decision, and this would be an opportunity at the annual visit, which is covered with no copay, to say, oh, by the way, I had a rash, you know, they actually treated me for Lyme disease. I could put that in the medical record, and then you don't lose that continuity of care. So if you do take advantage of those other services, which I would encourage you to, you can update your practitioner at a later time. And then for medications, this is where due diligence and a little bit of research can save you just literally hundreds, if not thousands of dollars. Typically, when doctors and nurse practitioners prescribe medications, we know generally which ones are more expensive and less expensive, but that can change. It could also change on the pharmacy. And what I would encourage everybody to do is a website called goodrx.com. It's just goodrx.com, and you type in where you are and then search for your medicine, and it will tell you the different prices you may get at different pharmacies. And I've had patients where at one pharmacy, the cash price of a medication will be $300. Down the street, it will be $60 with an online coupon. I know we're used to online shopping and not really trusting online coupons or thinking they're not going to be accurate, but GoodRx coupons are, my experience is 100%. I've never had a coupon fail. And especially if you need a medicine that's not on your insurance plan's formulary, or your medication deductible is so high, it's sometimes cheaper just to pay the cash price with a good coupon from GoodRx. Also, patient assistance programs for people who do have high deductible plans, especially for very expensive medicines to treat psoriasis or rheumatoid arthritis or many of those chronic health conditions, can cost upwards of $1,000, $2,000 a month. Their website will have a patient assistance program that you can apply for, and the nurse or the medical assistant or your primary care provider should be able to help you with that. Here at HealthFinders too, we are experts at these sorts of programs and getting the best price, so please call us or come down and visit us on Central Avenue, and we could do a little bit of detective work for you as well. If there's one cost-saving tool I would give to everybody, it would be goodrx.com. Another bit of advice, and this one I think most people know of, is once you have met your out-of-pocket maximum, try to anticipate what else you, your children, anybody in your house might need. Do you need a mole looked at? Have you been thinking about getting a sleep study for sleep apnea? Just if you had the misfortune to have an accident or emergency room trip, you've met your deductible in February, really think about packing in whatever health advice you want. I wouldn't want people to waste their time for anything that they don't really need, but if there are things you were thinking of doing in the next couple of years, bring it up. Or if you've always wondered, if you needed your eyes looked at by an ophthalmologist, or again, usually a dermatologist is a good example, now is the time to do it. And of course, if you've had the real misfortune to have a serious illness or a serious accident and a pile of bills that you don't know what to do with, and you feel like your health insurance is not covering what it should be, or you're having a lot of surprises, there are advocates not at HealthFinders, but these are advocates you could find through local insurance firms who will help you sort through the bills. And typically these people pay for themselves within one bill. Combing through medical bills, finding duplicate charges, questioning things, asking them to be rerun as a different code that your health insurance might be more likely to pay for. These are all things that can save people tens of thousands of dollars if they had something just drastic happen to them and they're not feeling like they're getting the coverage they expected. And then finally, just ask anybody questions and be prepared to be honest with your provider. I can imagine if I went in for my annual wellness visit and I was very concerned about a bill, I would say to my nurse or doctor, I don't have in the budget for this to turn into a billable visit. So if there's anything that comes up that you are going to charge me separately for or bill separately, please let me know beforehand, because I don't want that. And I think most providers will understand what you're seeing there. And know that the structure of these wellness visits is really looking for problems is covered. It's not free, you're paying a lot for it, but looking for problems is typically not billed to you. But unfortunately, if problems are found, that's when things do get expensive, which is very unfair that you get this sort of double whammy of finding out that you do have high blood pressure, or you do have trouble with your mood and you do need help. Unfortunately, that is when a bill does come. And I don't have any advice for avoiding that, but I think it's good to be prepared. But in order to prevent that being a surprise, you can talk with your doctor or nurse about what's happening. And you can also call the number on the back of your insurance card. You may not always get the answer you want, but they will at least be able to guide you in the right direction. And again, HealthFinders Collaborative, we provide we provide primary care, and also we sign folks up for MNsure and help people, guide them through Marketplace and state plans. And we're also just available to help people navigate the healthcare system, either with pharmacy or bills, applying for charity care programs, applying for assistance to get coverage for expensive medications. Please, think about us. That's exactly why we're here, and we are happy to help. Again, I'm Emily Carroll, a nurse practitioner at HealthFinders.